Throughout this class, you have heard about the electronic health record, and you've heard about different parts of the record. So my objective today is to put that all into perspective for you and see how the electronic record works with everything else. So let's imagine, what if you were in a different country and something happens and you are sent to the emergency room and they're asking you, how long ago was it that you had surgery? Or have you had your immunizations? And either you don't remember, because we usually don't have those kind of things on us, or it could be that you are not conscious. So how are they going to find out something about you or how to treat you? Now, we talk about in other countries, but let's bring it even a little closer. So we are all familiar with the natural disasters. This is one that was a little closer to us in Joplin several years ago, where the tornado hit the hospital. So how were they able to treat these patients? And what happened to the medical charts? I mean, they did not have power. Parts of the hospital were not functioning. So what would be that answer? The EHR. During the time that the hospital was having this, and shortly thereafter, the hospital previously had gone to 100% electronic records. And they built the area that was housing their server with backup generators. So there really wasn't very much downtime. And they were also able to let other organizations, other hospitals and providers have access to those records so they could treat the patients at a different facility. So years and years ago, no one knew what the EHR was, an electronic health record. What is that? It just means that instead of it's on paper, now it's in the computer. And then some people are like, well, it's just something the president said we have to have, and so we just have it. And then a lot of people back then said, I don't think it's anything I need to know about. Well, as we know, it is something we need to know about. It is in everything that we do as health professionals, as patients. It houses all of the information. So it has become something that not everybody was aware of, to now we couldn't imagine living without it. But it is a lot more than just your records. Yes, it is your records, but there's more that goes into that electronic record. We have several different things just within the hospital. And I use hospital because they have that PACS system and everything. More so, they have that lab, and whereas your family physician would not. But this is relevant to that family physician. They would have access to these other parts of the EMR. So we're going to go through each one. So the CPOE, this is where the doctor has a login of his own, and he will actually log into the EHR. In this EHR, as you kind of see in the slide, it will have all that patient information. So ideally, the doctor could chart, he could do refills, he could review test results, all before he even walked into the hospital. Then, when he gets to the patient room, all he has to do is talk with the patient. It's not designed that it's going to take over that face-to-face time with the patient. But that's kind of like the idea. While the big, I think, is a big advantage of the CPOE is when you have doctors that are covering or on call for other doctors and you have a problem, that doctor pretty much has to go on what you've told them and treat you basically not in an aggressive way, just enough to get you by until the morning when you can see your doctor. But now, with the CPOE, those doctors can go into your record. They can see what medications you're on, and they can treat you more efficiently. So no longer are they flying blind. They know. Another thing that is really kind of important with this CPOE is that it will highlight abnormal results. So when the doctor does log into the system, he will have flags that say, hey, you need to look at this particular chart. That helps that review of those abnormal results happen faster than if it was just a paper chart sitting on a desk and when he gets to it. Another database that you probably saw it happen a lot faster than the EHR is the PACS system. That's in the radiology, sonography, that area of the hospital. And basically, you're not having to process films anymore. Those pictures are taken, they're loaded up to a system, and I mean, basically the radiologist could be in the very next room reading and interpreting those films before the patient has even left. There's also the fact that you're not having to go and get your films and take them to your surgery consult or to the hospital where you're going to have your surgery. That physician can log into the PACS system and he can look at them in real time. The other way that films are, I still call them films, how they are given or transported is on a CD. They can load these images onto a CD and you take it with you. Films used to be very hard to transport because, one, they were big, you get enough of them, they're heavy, and they're sensitive to the heat, so they're very easily destroyed. Now, the PACS system can actually be a part of that EHR. So you'll have a tab that says, radiology, and you click it, and it'll take you into their pictures, which is very good. You have eScribe. We have all been to the doctor, and no longer are they writing out a prescription for you. They say, what pharmacy do you use? I'll call it in. Calling it in is kind of the old way of saying it. What the provider does is he goes to the EHR and he sends that request electronically to the pharmacy. The pharmacy fills it. In a month, say you need a refill, the pharmacy will send an electronic request to your provider and he will say yes or no, and that's all done electronically. It's not done when you have certain prescription drugs. Usually that is the hydrocodones and more of those pain medications that are easily abused. They still write those scripts and you have to go each and every time to your doctor to get them. But that is not the norm. That is kind of the exception. So with this, you're getting the documentation in the EHR that, this prescription was sent, and refills, it's all documented in there. You're not having to write the prescription out and then make sure you put it in the chart later. So it makes it faster, safer, and there's less theft because you don't have those prescription pads anymore. Release of information. I kind of alluded to this when we were talking about the PACS system and the disk. You see this picture here of the tall files? That is what it used to look like. And you would have to go through those files and see the request and say, well, they just need a lab result. And you got to look through that, take it out, fax it, put it back in, or copy it, put it back in the chart, file the chart away. Now it's much easier because it's all in the computer. You go in, you find that lab result, you either send it electronically, because if it's someone within your organization, a doctor's office that also has privileges there at the hospital, many times you can just send it electronically to their office, or they can sign in to the hospital system and see it. Or you can download it to a CD, and the patient comes in, picks up the CD, takes it, or mail it. Mailing is a lot easier with a little CD than it is big packs of paper. So it's quicker, it's safer, and it's cost effective because you're not having to do all that filing and use paper. So some of the advantages of the EHR altogether is your consistency in your continuation of care. As you can see, everybody has access to your information or can be granted access to your information. One of the things that I did not mention before, and this is something that isn't used as much as it should be, is the patient portal, where patients actually can go in and get their own reports. They can go in and find their own records that they could take with them. There's a whole different advantages and disadvantages to that. But for now, you have the EHR, which means you always have that information available. The documents that are there are easy to read because you're typing. You're not having to decipher handwriting. And when you are trying to transfer a patient, or you need that chart for any other reason, it's there. You're not having to say, oh, it's on Dr. A's desk, we've got to run and go get it. You have your quality and safety. Again, back to where there was no guesswork with the doctor on call. Patients, especially the older patients, tend to be on a lot of medications, and they don't necessarily have a list of their medications on them all the time. So having that access to the EHR helps in knowing what they're taking, especially when they're taking so many. And your lab results. Those kind of things are very important and something that all of your providers need to know. And then efficiency and saving. I say it as an advantage because you're decreasing the employees needed to put charts away. Some people see that as a disadvantage because they're afraid that you won't have the job. But in healthcare, those file clerks are now being used for scanning in records that aren't necessarily transferred, or any kind of paperwork that would need to be put in the file that's not part of a form. Those people are now going up in the ladder. They are reviewing or document specialists. So even though it says decreasing employees, that doesn't mean that they're out of a job. They're just doing a different job. Efficiency and savings on archiving those charts. When you get so much paper and you have to keep them for 7 years or 10 years, imagine how many boxes of charts that you would have to store and pay someone to store them. Not very many hospitals have, enough room in their building to store all those records. And then again, you have your release of information transmitting from one computer to another. So you can see how the EHR helps and is an advantage for everyone, a provider and as a patient. So I hope now that you have that idea, and let me know if you have any questions.